is Dr. Lim, Orthopaedic Surgeon at Gleneagles Hospital. He's going to assign me my next challenge. So Doc, what are we gonna do?
Well, Ralph, I'm going to ask you to do a set of Deskercises. It is something that you can easily do in your office. Well, can you stand 1 meter away from the desk, please?
And?
Well, I'm going to ask you to do desk push-ups. Can you do 20 repetitions in 1 minute? And if you can do more, go for it.
Okay.
Well, so how do you feel?
It was quite refreshing. It's not too troublesome and my arms feel a bit tired.
Well, that's fantastic then.
So many of us enjoy the occasional game of tennis or golf, but many of us experience aches and pains afterwards. So when should we pay attention to these aches and pains?
Well, I think it's normal for anyone to have some aches and pains, maybe after a heavy game of tennis or a long golf match for a couple of days. But I think that if the pain lasts beyond 2 to 3 weeks, then maybe we should pay just a bit more attention, because it may mean that there may be a bit more serious injury. So what do I mean by more serious injuries? Well, in particular, let's say in tennis, the most obvious is you've heard about is tennis elbow. So in tennis elbow, the problem is that there is a damage to the tendon in the outside of elbow, which is here, which is over here. Alright, and in this situation, there is inflammation in the tendon, and sometimes there's damage. So most of the time, this will go away after a couple of days or a couple of weeks. However, if it's persistent, it may mean that you may need to seek the doctor's treatment. The other problem that is common, especially because of overhead service and overhead smash in tennis, is because of rotator cuff tendonitis. In this particular condition, there's inflammation of this tendon over here. Now in this situation again, a couple of days of rest and some anti-inflammatory medication may help to get the condition better. But if not, again, you may need further treatment and you may need to seek the help of your local GP or of your orthopedic surgeon.
So, what can we do to prevent injury?
Well, there are a few things we can do, but it all boils down to adequate preparation. So before playing a match, be it a tennis match or a golfing game, it is important to do a proper warm-up so the body is prepared for the sport. Well, secondly, it is important also to have proper equipment, the right kind of equipment. And thirdly, obviously, when we play a certain sport, for example tennis, we were talking about tennis elbow just now, it's important to do a tennis stroke. Well, let's take the example of tennis. In many of us who play tennis, some of us actually use an incorrect stroke. And using an incorrect stroke, for example the backhand stroke, can give rise to the common problem of tennis elbow. Tennis elbow injury occurs when we use excessive wrist movement during the backhand stroke, like so. When we do this, and you do an extension of the wrist in this way, in hitting and impacting the ball, this can cause injury to the tendons over here, and therefore we get tennis elbow injury. To avoid this injury, it's important to use a correct stroke. In this situation, we must position the body correctly, like so. Hold the racket firmly with the wrist, and therefore execute the stroke correctly and bring forward the body in this way with a proper follow through. In this way, we can reduce the risk of tennis elbow injury.
That was a lot of useful information. Also, make sure to try to beat my score and share it with us on Instagram at #Topofyourgame.
Before you start this challenge, I would advise that you seek your doctor's approval first. After you begin the exercises, should you feel uncomfortable or you feel pain or soreness in anywhere, please stop and discontinue this challenge. I would advise that you go for a medical checkup and get a clearance from your doctor first. Once you are cleared, please start small and slowly and progress gradually as you build on your physical challenge. All the best.